Last time we covered a lot of ground.
We did.
We said a lot of things, but I felt like I didn't say anything really interesting.
Oh, you're kidding me.
No, because the really interesting things happened to me after.
Okay.
I don't think we got really into the nursing and taking care of people with HIV and going to San Francisco and getting my master's and.
Okay, so that's important for you to talk about.
And when I was getting my master's, I was taking care of my mother as a hospice patient.
Oh, wow.
While I was getting my courses in hospice and bereavement and getting my master's program for HIV. And she had exactly the same kind of cancer that I have.
Really?
Really.
Is there a genetic component that you know of, or is it coincidence?
We were both smokers. She had it on her right side. I have it on my left side. I do know that it's a very fast-growing cancer from her timeline, because she was trying to get a green card to stay in the United States. She had a chest X-ray to do that. That X-ray was clear, and it was taken in July. She started to have very severe shoulder pain, and started talking to her doctor about it the end of November, beginning of December. He treated it for months using different non-steroidal anti-inflammatories, to get the strongest work, and none of them were working. And he was just getting very upset by it not working. And he referred her to a rheumatologist, who referred her to get a chest X-ray because she was a smoker.
Well, why didn't her original doctor have her get an X-ray?
Because he had already got an X-ray in July, and it was clear.
Oh, but this was November.
Right. But
he just wasn't thinking.
it was clear. I mean, in his head, it was clear then, so it's clear now. She had pain starting in November, and she was getting it treated by December. The doctor tried many different treatments, but he thought it was bursitis or arthritis or something else. And he thought that it couldn't be cancer because he had a good X-ray. That he didn't think that things could change so quickly. And it was April when she saw the rheumatologist. And he immediately sent her for a chest X-ray. And she was waiting until Monday to get the X-ray of this particular weekend in April. And I came to visit her in Santa Rosa that Sunday, and she was crying because she couldn't stand the pain in her back. And she was barely able to get to the door to answer us, the doorbell when we rang. And so I stayed with her, and I called her doctor on Monday morning, and I said, please have her get an X-ray of her back as well, because she's having a lot of back pain. She was diagnosed in April. She was dead in June. So less than a year, it went from 0 to dead.
And when were you, because I don't think we really talked about your illness at all last time.
No.
When were you diagnosed?
In February.
Of this year?
Of this year, yes. And it was stage 1B. I was getting short of breath and a little bit dizzy, but not really. I was in the hospital for 2 days. on admission they did a chest x-ray and they found it, and it was about the size of a plum. Whereas my mother's, when she had her x-ray, it was the size of a grapefruit. And it was pressing on the brachial nerve here, which is why she was having so much pain. Anyway, the doctor came into the emergency cubicle to show me the x-ray, and she turned it to me, and I saw that big white spot, and I went, ah. And she says, we're concerned about this. We want to do a biopsy. We think it's cancer. And I said, oh, okay. And I think I'm the only one that knows me that thought, oh, good. Because I have fibromyalgia, which is quite painful.
And difficult to treat.
Difficult to treat. So many things, so many symptoms that I was having and bringing to the doctor, and that I found very troubling and upsetting. The tinnitus that was so loud I couldn't sleep. The achy breakies all over, which I had had for so long, because the end was near. The suffering was going to be over. I've been on disability for almost 9 years for the fibromyalgia. Even before I knew that I had anything like fibromyalgia, or because of my work with people with HIV, I knew I was going to die. And I knew it was going to be something that I was going to have to go through. And I made up my mind I wasn't going to fight it when it came. And I wasn't going to have chemotherapy, and I wasn't going to have radiation, and I wasn't going to have surgery, and I wasn't going to have this, and I wasn't going to have that. Please leave me alone. Let me enjoy the rest of my life. I don't want to spend it puking my brains out and throwing away my hair.
Right.
Well, unless I get it cut off and a nice haircut.
But why did you think that you were going to die?
Because I was alive.
Because you understood our mortality.
Yes.
Our own mortality.
Yes. And I didn't think it was going to be HIV.
Okay.
But I didn't know the name of the bullet.
Gotcha.
But I knew a bullet was coming. And when I learned that I had the adenocarcinoma in the left, as my mother had adenocarcinoma in the right, I said, oh, this is a gift from God. And because I took care of my mother doing hospice care, I have a map. I know what it's going to be like. I know what I'm going to need. I know what I'm going to have to ask for. Well, there you go.
So you asked for hospice right away without doing any treatment?
Well, not quite right away. I did some primary doctor shopping first. And I ended up with Benedum Geriatric because they would take care of me as a regular patient, so I could get to know them and decide whether or not I wanted them to supervise my hospice care. I asked the oncologist that gave me the diagnosis, and when I refused all treatment, he was very unhappy. And I finally had to ask him, to get him to stop pressuring me to get treatment, I finally had to ask him, are you trying to bully me into getting treatment? Oh, no. I'm just trying to make sure you understand. I said, I understand completely.
And he knew you were a nurse.
Yes. He knew I was a master's prepared nurse. He knew my mother had this treatment.
So he knew your history.
Yeah.
But there's so oncologists are so focused on
keeping their records so that they have the most number of successful treatments, because my cancer was at a very early stage and he could eradicate.
Oh, so that was probably driving him nuts.
Yes, he says, don't you know that I can treat you and you can live happily ever after? And I thought, what planet are you from? You treat people that are dying every day. When are you going to get it? You're going to die.
I wonder if he refers to hospice. What was his, did you talk to him about hospice?
Yes, I said, if I decide to get hospice treatment, will you be supervising that care? And he said, well, normally I would, but you wouldn't be a patient of mine. I wouldn't accept treatment. If the treatment failed for some reason,
he had done everything.
He could.
He could. Then he could see.
Then he could see.
Not from the get-go.
No. So I thought, well, boy, I'm glad I asked you that question. And then I went to see my primary care doctor, who was just a regular internal medicine or something like that. And I said, so when I get hospice care, are you going to be able to supervise it? And he said, well, we can get it started for you. I'm like, that's a no. And I said, at my first visit, when I get hospice, are you guys able to supervise? Oh, we do that all the time.
At Benedum.
At Benedum. And I said, like this answer. And they said, and you know, one of the things that we really suggest is you get it sooner rather than later. And I said, oh yes, my husband will need all that support even if I don't.
And it's true.
And it is true. It is true.
So Benedum really does treat the whole patient.
Yes. You just got to be old.
Right. Yeah, you probably don't even fit geriatric.
Oh, yes.
Do you?
Oh, yeah.
Oh.
No, I'm 66 now. So I stayed with just them doing the primary care for a little while. And then, I was taking tramadol for pain, which is the preferred medication for pain for fibromyalgia. And the narcotic medications generally don't work for fibromyalgia. So they suggested that I stay on the tramadol, but they increased it significantly for me. And then one day I had really horrid back pains. My back was spasming like crazy. I'll give you a clue how much my back hurt. I turned my side of the bed up to 100 and supped on it flat on my back, and that helped a little bit. Tramadol did not help. And I called the doctor and I said, I want to tell you that I'm really having horrible, horrible pain, and I want to come in and talk about hospice. I was being treated by my psychiatrist at Benedum, and so I knew about the clinic. And I thought, something for, you know, if I needed a different doctor later, but it's kind of a hassle. It's in one of your hospital. We have to drive. We have to pay for parking. Oh, well, we'll cope now. Probably not too many trips in at this point. Yeah. But it's good.
So, is our medical director now following your care, or you're still under the care of Benedum?
I'm still under the care of Benedum. And In fact, I had my pain meds adjusted today by a doctor that was covering for my regular doctor who's on vacation.
And pain management wise, they're pretty good?
They've been quite responsive. When I went in to see the doctor on the 17th, which was the day I was referred to hospice.
On June 17th.
June? No. July?
What are we in?
Yeah.
August.
Yeah, we're in August. July.
So you've only been with us a couple of weeks then.
Yes, I've been. Yeah. And I'm getting all the services at once. Like,
yeah. That's how, unfortunately. There's no way around that, I don't think.
No, I don't think so either. Especially when you've got somebody like me who's not laying in a bed in a fetal position on so many pain meds that they can't talk, and who wants to do legacy with them?
Well, they can't. Right. And I'll tell you, it's people get to a certain point where they're withdrawing, and then they don't want to, and that's kind of what you're describing. So it's good when we can catch someone while they're still feeling well, and yeah.
So, but I find that I'm doing a little of this distancing. It's very interesting to me. I know too much not to notice, which is cool.
Because you were kind of analyzing your own.
Well, somebody has to analyze me.
Right.
Who better? I can do it from the inside.
Yeah.
I'm detaching from stuff. Things that I wouldn't part with for the world. I don't want. I know who I want to have it. I value it a lot.
But it's easier for you to...
It's necessary for me to get it out. I told my daughter about my diagnosis. She's in nursing school. When I graduated from nursing school, see that memory thing again. There's a particular brand of statues that are tall and slender and pale blue to medium blue and white with different professions.
Oh, are they,
Yeah, see? Those.
I think I know what you're talking about.
They're very expensive.
What are they made of?
They're porcelain.
Okay.
Yeah.
Do you know what they are?
My mom has a bunch of them.
Yeah.
A bunch? They're this tall?
They were my grandfather's.
Oh my God.
He collected them. I know what you're talking about.
Oh,
I have no idea
cool.
what they're called either.
It's just like the brand name. Anyway, I lusted furiously for this nurse one ever since I graduated from nursing school. It was very important to me. But we couldn't get one. We couldn't afford one. They were very expensive. Never mind. When we lived in San Francisco, and when I still thought we couldn't afford one, my husband bought one for me. And I was stunned. I was like, whoa, oh, I love it. Oh, we can't afford it. But you deserve it. Like, oh. You see why I kept him?
Do you still have it, or no? Does your daughter have it?
My daughter has it. Yeah. I packaged it up in the original package. I called. My daughter and I talked. We talked about my diagnosis. We talked about the length of time of the illness. And one night I decided that she had to have it right now. So my husband went up and got it all packed up, brought it down here. And Karen and her husband were here, and I told Karen about it, and I said, this is my present for you for when you graduate from nursing school. And she says, I'm not graduated yet. I've got another 2 years. I said, I know. You can either open it now and enjoy it now and the process, or you can leave it boxed up and wait until you graduate. But I'm giving it to you now so I know that you have it. And she said, oh, but Mom, you're going to be here in 2015. And I said, well, that wasn't the prognosis that I got from the doctors. And I told her again.
So she didn't hear it the first
She
time?
didn't hear it at all. She could not process it.
Right.
And I had been asking her to send me a copy of the email that I had sent her about what I wanted for my memorial service. And she says, oh, I'll get to it. It's too much work. It's hard. I have to go upstairs. I have to remember to do it. Well, I mean, she's working full time. She's going to nursing school 3/4 time. What do you want from the girl?
Right.
But when she got home with that statue, guess what I got in my email? There it was. Yeah. So.
So has she come to terms with your prognosis? Would you say?
I don't know.
Is she in Pittsburgh?
Yeah, she lives in Wilkinsburg. She used to live up on Ridge. And, but her husband is getting his other knee replaced, so he has to have a 1-floor situation. And, so... anyway, I don't know how she feels about it. I know she thinks that I should get treatment and live another 10 years. I know that. And I know that she's been versed enough in patient rights to know that I can pick, and she can't.
Do you want to talk about
Karen some more? I mean, I don't hear from her. She puts little things on Facebook.
Karen is
my daughter, yeah.
Okay.
But she's too busy. She can't process all of the stuff in her own life because she's attending to work and she's attending to nursing school.
Is there anything that you would want to tell her on this, or that you haven't told her, or that you feel like you would want to remind her of, or that you'll haunt her from beyond about?
No, I'm not going to haunt her from beyond.
Okay.
No. Well, I guess I'm going to say that even if I'm not living, I'm going to be with her.
I think that's the best message that anyone can tell their loved one.
The other night, I was having a great deal of difficulty with the handheld thing that you click on the bed to put the head up and the feet up, and it's attached by a wire to underneath the bed somewhere. And that wire is springy, twisted in a coil. And when you're trying to do things in the middle of the night without any lights on, these things get more and more difficult because I couldn't get out of bed to turn on a light and I couldn't reach the light. It was very frustrating. And when I was really at the end of my rope, my mother was there. And she says, "Don't worry, I'll help you." I don't know if I was dreaming. And it doesn't matter.
And that's what you hope for your daughter.
Yeah, well, that she'd have a sense
Right.
that I was there.
Oh yeah. Does she believe? Do you think in you know, everybody has different belief systems about after we die, where we go, heaven, hell.
Yeah. She has a strong Christian faith.
Okay, so.
And when I was planning my memorial service, I planned to have the minister of her church do the sermon. And the reason I did was because I thought it would give her a strong source of support, and that she would receive it more readily. I think she's going to have the most difficulty with this. I think she really is. But
I think that makes sense, that she has a connection to that pastor and can not only hear his words and feel comforted, but know that she can get support from him.
On an ongoing basis over a period of time. I think that's... And so, that's what I think about for her.
Did she become a nurse because of her mother, or is she old enough to admit that?
Maybe.
Is she following in your footsteps? Is she, is this a second career? Or?
Yes. Well, she had a job as an electrician, but she was still an apprentice. But she was an advanced apprentice. You have to go through several years and go to community college and take theory classes and so forth.
Wow.
It's more than taking a wire and stringing it through a building.
Jeez, I'm impressed. I had no idea.
And you have to know how to read schematics and understand what they mean and what you can and can't do so that you don't blow up the building by crossing a wire so you shouldn't be crossing. Well, oops!
Doesn't sound like something I should be playing around with.
And the thing that she liked about being an electrician is that it was intellectually stimulating and it paid good money, which is always important. And then she was in an automobile accident, which hurt her shoulder, and she didn't have the upper body strength anymore to do the stuff that you have to do to be an electrician apprentice. She could be a licensed electrician and just not take those jobs that require that strength. But to finish the program, she had to do all those lugging ladders and stuff like that. So nursing seemed like an alternative. She knew what that path looked like.
There's so many options, too.
Yeah, so many options. But I don't think she's really totally absorbed that yet. And I know that I didn't at that time in my career.
Right.
You know, I was getting work in the emergency room. And
Now, how did you come to HIV/AIDS?
Okay.
I don't remember if we talked about that last time or not.
I don't think so. See, that's what I mean. We didn't get to any of the interesting stuff.
I thought pretty much everything you were saying was pretty interesting. But.
Okay. Well, at least that is interesting to me. When I worked at Presby. I worked on the cardiac transplant and cardiothoracic surgery and cardiology unit. And after a while, and this was around the time that AIDS was like starting to blossom in the mind of America as being something that we really needed to worry about.
Before it was just a gay disease, or...
Yeah. My father at this time asked me if he was the judge at the dog show and the handler of the dog happened to be gay, was he at risk of getting HIV disease from his dog?
God.
I said, no, Dad. Even if the dog spit him, I said, no, Dad.
Well, we can laugh, but I was in New York in the 80s. I mean, I remember...
Well, I mean, this is when it was...
We all had. Before
Yeah,
we really
everybody had it.
disease.
Yeah, and... I started to realize that the immune interventions that we were doing so people could tolerate their transplants was the chemical equivalent of giving somebody AIDS. Because they were getting all the opportunistic infections that people with AIDS get. Because their immune system wasn't there to fight them.
Right.
And people with AIDS do not die of HIV disease. They die of opportunistic infections. I can't tell you the number of patients that we admitted to our hospital with pneumocystis pneumonia. And lymphoma, and, you know, the list went on. And it was all the stuff that, you know...
Is it Kaposi's sarcoma?
Kaposi's sarcoma. Not too much of that, because that requires another virus.
Was that predominantly
Well, it was...
something that gay men got, or no?
Yes, because they transmitted it so readily. Where am I? I know, New Kensington. Anyway, so I kind of got disgusted with that, and I just... And then my boss was being, you know, if you want to work, you have to work evenings, and that kind of stuff. Well, I told her. I says, it may very well be true that if I want to work here, I have to work evenings. But I don't have to work here at all.
Bye-bye.
And yeah, that was it. You know, packed my stuff and left. She was like, that was quick. Stopped downstairs at the nursing office and got my license and left.
And where was that Shadyside?
Presby.
Presby.
They were like, how'd that happen?
Now, were jobs easy to get? Was this in the 90s?
No, this was 1988.
Oh, okay. So jobs were pretty. Were they? That was before I was a nurse. Were the jobs plentiful then, or?
Not so much.
No. Okay.
But
because you know it goes up and down.
it goes up and down, and I figured that I was going to get a job, and I was going to love it for about 3 years.
Is that your?
Yeah, that's my little window of opportunity for loving my job. And I really have never had trouble getting a job when I wanted one. Never had that problem. So I answered an ad in the paper for VNA, and I thought, oh, cool. I went and applied there, and they hired me. I had about a week of orientation, and they set me on my way. One of the things that was really cute that I had in orientation was the nun that was taking me around.
Oh, that's right. You talked to.
Oh, I said that story already.
Yeah, but it's not on
okay.
camera.
The nun that was taking me around got to the street and didn't get to the house number and was totally flummoxed. What do I do now? And I said, okay, we're going to turn left here, go up to Center Avenue, turn right, get to the house number, and turn. She says, how do you know? And I says, trust me, we'll try it. She says, okay. And we went, and there was the street, and there was the house that we were supposed to go to, and everything was fine. And she said to me, how did you know that? I says, because before I went to nursing school, I drove a cab for 3.5 years. So I didn't have the normal...
Right.
And I really did like home nursing.
I would think it would be attractive to you, just the autonomy of it.
The autonomy, the variety of patients, you know.
Right, it's not like the same.
No. Same old,
right,
no.
Every day.
It's different. Then my supervisor was flummoxed herself. She said she didn't know who to give a certain case to. And she says, you know, I just don't know anybody here who has any experience with pneumocystis pneumonia. And I said, oh, that would be me. And she says, really? I thought you worked cardiology. And I said, yes, that's right, but we had transplant patients and they got pneumocystis pneumonia all the time. Send me. I can do this. Oh. Okay. And off I went, and it was a very nice young man. I gave him shots and took care of him, and then there was another case of something else, and another case of something else, and I got it. It was like, oh, all of these opportunistic infections go with HIV. That, you know,
right.
I had all that bit, but I got that if I specialized in HIV, I would be specializing in a whole bunch of stuff.
Right.
You know, there would be reams and reams of information that I would have to know about every body system, because you'd have to know neuro, you'd have to know you know, the whole 9 yards. So I thought, boy, that's cool. Because what I had wanted to do before I left the cardiology unit was to work in the emergency room, and I applied there 3 times, and they didn't hire me. And I was not happy. But okay, you don't want me, it's fine by me.
You found your way.
Yeah. And so then at that time I was living with my 3rd husband, 4th marriage in Pittsburgh, and that's where he preferred to live. And we stayed here, and okay, and then about 2 years after we had bought our house where he wanted to live, he told me that he didn't love me anymore. This is not a good message for your wife. No. I don't care what you have to say. Do not say that.
But is he the one that wanted to live together anyways?
Oh, yes.
Yeah.
Oh, yes. He just wanted to share, you know, his feelings.
Oh.
Well, I didn't take that so well. I don't know if you could imagine that, but anyway, I said, well, if that's true, I'm not going to be making all my life decisions based on what you want. You can do what you want. Okay, do what you want. And I went to a, what do you call them? You know, where you go for like 4 days and you have different classes and you get CEUs and...
A conference?
Conference, thank you. And it was in Hilton Head, which was a very nice place to go.
Nice.
And...
was it all on HIV?
Yes, it was on HIV and... was it? It wasn't just pediatric, no. It was on all nursing and HIV and AIDS, not just the medical side.
Mm.
And so I went to this conference and I found out that the University of California, San Francisco had a master's program that gave you a minor in HIV and AIDS, and you could pick your major, you know. And most of the people who picked the minor of HIV and AIDS picked the major of oncology and that kind of stuff. Well, Beverly's different. I did psychology because I knew, well, psychiatric nursing, because I knew that dealing with people that were addicted to drugs, I would have to have that. I knew that there was a lot of psychiatric implications to having AIDS and how they would, you know, blah. So that's...
Yeah, I think that makes good sense. Actually.
Yeah. And I said, you know, if it's med-surg, I can learn it, but I want to have some kind of basis for this psychiatric stuff. So they let me do it, and that's what I did. And it was a very good experience. And then after that, I worked as a case manager for an insurance company. And case managers are not spoken of dearly by people who work in the community and have to get approval from insurance companies.
How bad, Peter?
Not too well, yes. I had one nurse call me from Washington, D.C., and she says, I need to get approval from you to give this patient 4 hours a day. We're going to be giving him amphotericin every day. And I said, no. She said, what? I said, you will get 6 hours a day. I want this patient pre-hydrated, pre-medicated with Demerol and Benadryl. And I want you to observe the patient for a period of time after the amphotericin has stopped. Please. She said, you really know this stuff, don't you? And I said, yes, I've taken care of people on amphotericin. I know what can happen. It's not pretty. I want the nurse to have authorization for the hours she needs so that she's not trying to deal with absolute blown out emergency plus trying to get hours from me. Never mind, she's got them. Wow. Fabulous. He wasn't on amphotericin that long. How many hours did that cost Blue Cross? not enough to put any skin off of my nose. But so I was the case manager you wanted to get.
I'm sure.
And I had another patient who really needed, what do they call that? Oh, insurance case managers have this word. He didn't really need nursing care. He just needed somebody to be there for him.
Custodial care?
Yeah, custodial care. And so I got permission, because I had to call the big bosses up and, you know. I said, this patient has a really bad skin rash and he needs lotion and stuff put on it every 4 hours. Now, his partner cannot come home to do it, and the patient is not competent to do it himself. So I'm going to tell you, it's going to be this way or that way. He's going to get 12 hours of home health care. Who can apply a lotion to the skin if they're supervised by an RN once every 2 weeks. Or he will get 3 RN visits a day to apply the lotion.
Let's see, which is cheaper?
Ah, you picked the right one, honey. Am I good? And then the nurse manager changed at that company. And she called to get a renewal. And he had been getting this for a year and a half.
Wow.
And I said, well, yeah, as I recall, this patient has a very terrible skin condition that needs a lotion of some sort to be applied every 4 hours. And so we've approved the home health aide to apply that lotion every 4 hours and then supervised by the RN. And so can you tell me about his skin problems? Oh, he doesn't have any skin problems. I said, I'm sorry, I think you said he did not have any skin problems, but I don't think that's quite what you meant.
I'm sure what you meant to say was...
Well, it's still not resolved and we're working on it. No, I'm sorry, you have to tell me. No, she didn't say that.
Yeah.
She said there was no skin problems. And I guess she was a strong advocate of telling the truth.
You know what's sad though, Beverly, is they wouldn't get, nobody would authorize that for such a long time now. It's changed so much with home care. It's in and out.
I know.
In and
But
out.
Beverly did. For as long as I worked for that company, I did.
Yeah.
And they put up with it. And they put up with it for a very good reason. Our patients cost them a hell of a lot less with me taking care of them. Because they didn't crash and burn. They didn't fly into the hospital in and out and in and out and in and out. Why not? Because they were getting the care that they needed right where they were at the... You know, if you keep somebody from crashing and burning, you are doing really, really, really good favors.